The Pulmonary and Critical Care Division is has had a fellowship for at least 40 years. The first fellows graduated sometime in the early 70s. And so we have a history of having trained excellent fellows who have come out of this program, who've gone into academic medicine. Many of the fellows have actually stayed on faculty in our own division.
I think this program is, a lot of it is about physiology and teaching basic physiology and understanding that everything in medicine really comes back down to the basics. And so our focus here is really about that.
The reason to come to this fellowship, I think, very importantly, is the emphasis on physiology. Our program is excellent in physiology. We have a weekly physiology seminar that provides the foundations for pulmonary and critical care medicine.
The last 3 years really showed me that I made the right choice by choosing this fellowship. It's very well balanced. It's a good balance between pulmonary, with critical care. You get to experience different types of ICUs, either the medical ICU, cardiovascular, neuro ICU, surgical ICUs. Same thing from a pulmonary standpoint. You get a very good exposure to patients with malignancy, different types of infection, interstitial lung disease, obstructive airway disease.
We really try to develop an individual based on what area they really enjoy the most. And we have a lot of different things that we try to encourage people to do because we know that not everyone has the same interests. So we have a global health track if somebody wants to be interested in doing global health. Other individuals who are more interested in doing interventional, we have actually a robust interventional pulmonary program here.
You're going to be ready to practice any type of medicine that you want. If you also are interested in academic medicine, there's a lot of opportunities here for teaching, develop curriculums, and prepare you to be an educator and a successful person in academic medicine.
So all in all, you get a great exposure to broad range of clinical medicine. You get great exposure to research, or you have research opportunities. And in general, Central Jersey is not a bad location to come to. Close to us is Princeton, which is a beautiful town, little town. New Brunswick itself is a nice little college town with lots of restaurants and good nightlife. We're an hour away from New York City. We're an hour away from Philadelphia. You just take the train line.
And we try to develop an environment which is very collegial and a place where people are encouraged to learn. But even more so, we really do try to make this place like a family.
It's a very collegial environment. It's 10 fellows, so you essentially work with 2 or 3 other fellows from the same year. You do get a lot of time for research. If you want to do bench research, you can do that. That's actually what I personally did.
We get calls from various parts of the country saying, we just have been working with a former fellow of yours. Do you have graduating fellows we can employ now? Because they know the quality they are getting.